Hi everyone, my name is Sarah Becker and I'm the Program Director of the Ministry of Education's English Teaching Fellowship Program, and I'm here today to talk to you about local and international health insurance. There are two kinds of health insurance within this program: national insurance called 9PS and international insurance. We recommend that everyone purchase with Compass Benefits Group, which is our ally and has a group discount. National health insurance, 9PS. What is EPS? In Spanish, this means Entidad Promotora de Salud, the translation, a health promoting entity. What does your EPS cover? Routine medical appointments, dental treatments, medical exams, medicine and prescriptions, hospitalization, surgeries, and family planning services. What is the cost? A medical appointment, dental appointment, prescription, or exam all have a cost of 1,800 pesos. That's less than approximately $1. Emergency services are paid for by the affiliate when the service is rendered and reimbursed by 9PS after treatment. How do you become affiliated with EPS? Once the English Teaching Fellowship team receives your cedula, which is your Colombian ID card, they will begin processing your affiliation. It will be crucial that the ETF team receives a clear scan of your cedula and your visa with your cedula number in order to complete your affiliation. This will be turned into your regional coordinator. 2 weeks after receiving all of your documentation and submitting it, you will be officially affiliated with 9PS. How do I use 9PS for non-emergencies? Your regional coordinator will give you a list of centers and hospitals in your region. You can also consult the 9PS website for all centers, hospitals, and pharmacies that are affiliated with 9PS. If you would like to make an appointment, you can call the number on the back of your 9PS insurance card. As with any national health system, the next available appointment may not be for a while. If you are very sick and in need of being seen sooner rather than later, you can also visit a clinic or the emergency room to be seen on the same day. If you need to make an appointment, you should call ahead of time. What about emergency situations? In the case of emergency situations, you must go to a 9PS hospital. This is why it's very helpful to keep a list of affiliated emergency rooms with you in your wallet at all times. If you are in a life or death situation, you may go to any emergency room and it will be covered, but only in a life or death situation. I have chosen to go to the emergency room, but it is not an emergency. What should I expect? Well, going to the emergency room when we are really just sick can be strange to some of us. This is a normal practice in Colombia as a way of avoiding a 2-week wait for an appointment. You can expect to walk in the emergency room and present your health insurance card or your cedula. Once you have done so, you will take a number or wait to be called in order to have your case evaluated. Your evaluation will determine your wait time in the clinics as more serious cases get resolved or seen first. After you've been evaluated, you will have a seat and wait to get called in to see the doctor. Remember, if at any point you need help with translation, you can call your regional coordinator. International health insurance. Why have it? Along with 9PS national health insurance, all fellows are required to have international health insurance. The ETF team recommends Compass Benefits. What is my international health insurance required to cover? We ask that it cover the following: international medical insurance up to $100,000, medical evacuation, repatriation of remains, and political evacuation. This plan also must cover you throughout your entire time in Colombia. When should I use my EPS? When should I use my international insurance? And when should I pay out of pocket? In the case of a regular doctor's visit or sickness, the best option is to use your 9PS. In the case that you need more urgent care or need to be sent to your home country, your international insurance is a good option. Hartford Change of Volunteers Colombia recommend Compass Benefits International Insurance. You may use another company, but you are required to know the details of your insurance policy. While the deductible on the Compass Benefit insurance plan is $250, most private doctors in Colombia cost less than that for normal visits. Therefore, if you would like to see a private doctor or specialist for a non-emergency and the cost is less than $250, you will pay out of pocket. Anything over $250 can be submitted to your international insurance. Helpful hints and lessons learned. Don't wait until you're really sick to figure out where the hospital nearest to you is, and ask for the support from your coordinator when you need it. Do not avoid going to the doctor because you're afraid of language barriers. Your coordinator is available to help translate, and some centers may have a doctor that speaks English. When possible, call ahead and make appointments. You have the right to show up at the clinic and wait for an appointment, but it can take a long time. Call the number on your card to make an appointment or have your coordinator help you. Remember that businesses such as Nueva Base use landlines, so you should call them from a landline or use your appropriate extension number, 031. Thank you very much, and we're looking forward to seeing you here in Bogota.